Welcome to the channel. Everyone who is logging in, come on to the channel. We continue with the talks that we started to make people feel good, to make people feel that they want to live a happy life. And you see, life is about holding each other's hand. When we are giving medical talks and talking to each other and helping everyone to feel good, and if someone is mentally down, you hold that person's hand, you get it. Life becomes so cool, life becomes so nice. Just imagine when you feel down, your neighbor tells you, come on, we can talk. How can I help you? You know, these problems, they can be handled like this, that. You feel you are loved. We usually talk, the first step of any problems healings come from the mind, comes from the mind, and the mind is the stone of what? Yes. Okay. Okay. Now, the mind is the source of everything. Your brain, your Christine Long. Today you are the first one to text. Christine. Wow. Christine today is the first one to text and tell us. Welcome to the channel, Christine. Welcome to the channel. We thank you and we thank you a lot for signing in and telling us that you are around. So remember, when you are coming to the channel, what we should do is you should like and share as always. So my people, my friends, the day has been so. Barbara, wow, Barbara, I've just been on Barbara's live. After so long, today I've gone to Barbara. I've found Barbara on a live. I usually tell Barbara, I don't want to miss your live. Please be shared. If I wish but the YouTube does not tell me you are live. I don't know why. Maybe there is some problem with my YouTube settings or what. But let me check and see how. Yeah, first today. Good. That is very nice. That is very nice. Yes, I was talking about mental health and healing and the programs that we run. You see, when you are mentally okay and everything is going so good and everything is fine, you feel that you are you are okay. Even when you are sick, the healing process becomes so fast. When you are sick, the healing process becomes. Greetings to you, Uncle Jamaican uncle, to be in the channel. Yes, come in now. You see, we were talking about congenital heart diseases. This time we have talked about heart. Yes, just a minute, guys. Yes. uh, uh, no, hii nilisema 1 times 1. Hii nilisema 1 times 1. Nani aliandika 2 times 1? Yes. Sijui kama unaweza kuja naye, lakini si ataona. Mwambie tu twende umuone dakika moja kwa sababu wako online. Yes, we continue and say that most of the things we do, most of your problems that you have, they start from your brain. Your brain is the major source of fuel, of regulation, of everything that you are doing. This week we have been talking about heart conditions, and we've not even finished. I've cut it down because I want everyone to be sensing the danger lines when it comes to heart problems. Heart problems has made people to go so fast, and you have seen what. Yes, come in. Ma'am, nimewambia ukuje tu a second. I'm doing something, sijui kama hata utakaa. Now this one was wrong. This one is supposed to be taken once a day, not twice a day. This is wrong. Supposed to be taken 1 times 1, and then this one is for pressure, right? Alienda nyumbani? Ako. Are you taking the BPs regular? but you can be passing by. A minute, guys, a minute. You can be passing by. Mchukuenge fresh at least thrice a week. So yes, so that this one we know how to can regulate. Here, 5 will stop. Back at the next review. So this one you revise. The one who gave wrong, he gave wrongly. 1 times 1. Let him continue with this. But after our second review, that is where I review this one and this one. Yes, sir. I continue talking to my student.
Yeah, so I purchase all of them.
Yes.
Okay, thanks a lot.
Welcome.
We appreciate it.
Okay. Now, heart conditions. Heart conditions. We have talked about heart conditions, and at times when we talk about heart conditions, what people think always is heart failure. But we have seen there are so many things. Marcia Thompson is in the house. King Ray is in the house. Every friend now is in the house. So if you have anyone who is not here and she needs or he needs this talk, please come on. Let's celebrate having a community. When I'm seeing Judy, who is J. Kingre in the house, I feel nice. When I see Christine Long, I feel good. I know a smile is somewhere. When I see Jamaican uncle, I see Barbara in the house. It's not just a walk in town, like I can just walk outside for a kilometer and then I meet Barbara is far away. Judy is far away. But a culmination of your mind, that's what makes you know that my friends are okay. By coming on, my daughter is here. My daughter, Miss Marie. Hey, hi, Miss Marie. You're doing good, eh? Very nice, Miss Marie. If you're good, I know if you are here, everything is nice. It's nice. Marcia, I don't know if you got what we talked about. You text me after this, you tell me I got it or not, or I'm still doing it. You see, I'm still pushing it to get. You see, now we have talked about heart conditions. Yes, everything is well. Thanks a lot, Miss Marie. I really want to see you on a plane visiting Brazil. I really want to see you on a plane visiting South America, Australia, giving us content, visiting historical sites, telling us I have been here. Miss Marie, I really want to see that because I've noticed you have the energy, and that energy should be used. Hey, amen. Yes, that energy should be used. So, guys, if you are watching, you notice that when I'm having some time, I go to every lives that I can. Any live. I want to support every friend of mine. Please support Miss Marie. Please support Miss Marie. Let's see Miss Marie with the energy of traveling to travel abroad and even locally. Yes. We have been dealing with heart issues, pathological heart issues, not emotional issues. Yeah, pathological heart issues. So, what I'm saying right now is, pathological heart issues, pathology. Patho means weakness. Logy means study. Patho means problem. In Latin or Greek, I don't know which, but I know patho means problem that you add. Today I have shaved. You see, I look good. So someone told me I should shave. The person that told me I should shave, please don't tell me to shave my beard. I've just shaved my head. It's because sometimes I like time. So patho means problems and logic means study. So let's add patho and logic means pathology means the study of problems. So the problems of the heart, pathology of the heart means problems of the heart. Yes. Not excluding emotional problems. Emotional problems, yes, but we'll talk about emotional problems. Now, when a person has heart conditions, akanesha, wow, you have joined the crew. Thank you so much to be here, Akanesha. Akanesha, which country are you coming from, Akanesha? Hmm? Which country? Tell us. Tell us. We can visit that country. In my book or bucket list of study and travels, I have uh, said that next year I'll start traveling a bit. I'll start going to Nakuru. I'll start going to Mombasa. I'll start going. Then I go out to Tanzania. Then I fly out to the US. I've not been flying out. You see, Hey, Rostana TV, I've met you today and you are supporting you. May God bless Rostana TV vlogs. I want to follow and see how you're doing, Rostana TV. Here, Akanesha is from India. India. Akanesha, my friend Timikata is in India right now. A very funny boy doing vlogs. Timikata is in India right now. Funny boy. Rostana, thank you. From Philippines. You see, we have people from Philippines. We are making friends. Now, if you are new here we talk about medical issues. That's why you can see on my walls, we have hearts, pictures of problems. Look behind me. You can see the cervical bones. You can see, because here we deal with problems and we help them. Now, let's get to work now. We have been dealing with heart conditions. We dealt with heart failure, thrombotic diseases. We dealt with diseases of Someone is calling me. Elizabeth, why? Hello? Yes. Now, we have dealt with diseases and very several diseases of the heart. We have dealt with diseases of the heart when a child is in the womb, a fetus is in the womb. You see? Yes? Hello? Nzuri. Yes. Yes. Can I finish this session? It is 6:30 and then I call you. I'll make sure I call you, please. Yes. Now, you see, uh, we have even dealt with problems when a child is in the womb. When a child is in the womb, and we have treated these diseases, and we have, by all my friends, I'm going to sleep now. I'm sleeping too much. Oh, Rosanna, thanks for coming in. Please rest. Please rest, but you can watch again next time so that you can see how things are going. So, Rosanna, thanks for coming in. Leave your like as you leave. We love you, Rosanna from Philippines. I want to visit Philippines one day, and meet the doctors of Philippines, both of contemporary and both of conventional. I want to meet the doctors of Philippines one day. So, Rosanna, thanks. Thanks, Benjamin. It's 9:42 p.m. here. Yes, and here it is 4:42 p.m. So, Rosanna, please rest and we will link up. When I start my travels, I know we will link up. I'll follow up in your vlogs. Now, my baby here is here. My child who is called Miss Marie. My last born, please support Miss Marie. Support Roger Skillia in the group as a moderator. Support Dorothy. Support everyone you see here. Where is the moderators? I want to see people links. Barbara, support Barbara. Yes. I want to see all these people's links flowing. Rogers, please do it. Do it. Support everyone. Christine Long, all the people that are coming in and are our friends. We want to support them wholeheartedly. You mean, you see what I'm saying? You see what I'm saying? Wholeheartedly. I want to see people grow. I want to see the people growing and giving us good content. So we were saying that one of the most important things that we really need to have in life is coexistence. That's why God gave us everyone. So let's see in the YouTube streets, the coexistence, is it helping us mentally? Yes, but today, oh, Dorothy is here. Dorothy, I I I answered your question yesterday. I think you watched and you are now okay. If you have any question, you can DM me privately. We get some to you, Dorothy. Dorothy, some to you, Dorothy. Dorothy, get the blessings from Rosanna TV. Now, Dorothy, did you rewatch? Because I know you are out of the platform as I continue to answer your question. So rewatch and stay with blessings, but you can link up with me and then we talk. We know how we can pull up things. Yeah? Yes, Dorothy. Now, if you have any question that is medical, even if it is not in the topic, please bless up, man. Bring it down. Let's discuss. You always see that when you give a question, many people come and try to answer that question. So I come in and give a culmination. Guys, don't forget to like and subscribe. My last born is telling you that. Hey, my last born, Miss Marie, traveling and vlogging, seeing sights, seeing places, seeing Miss Marie. Please, if you have not subscribed to Miss Marie, our last born, okay, do it right now. You see, it enables us to get more impressions. And also, like DJ Afro says in Africa, in Africa, Kenya, it is the only place we have a DJ even in movie theaters. So we have our DJ in a movie theaters who is called DJ Afro, who carries you one by one from where you are. If you have never stepped in Thailand, drops you to Thailand, to Philippines, and one by one, if I say it in Kiswahili, he usually say moja kwa moja. One by one, you start visiting Thailand through seeing what DJ Afro is bringing to you. So one by one, Miss Marie will be taking you moja kwa moja mpaka Bahamas in a cruise ship, Miss Marie. Hey, my people. I even start forgetting that we have a topic to cover now. Look, let's concentrate moja kwa moja, one by one. We gave all the heart failures, comorbidities, the problems that you can get when a child is, you are a mother and you are holding a child in your stomach. You get it. We got all those and all those that we have even right now. Rheumatic heart disease. If you didn't understand something about anything in heart diseases, please bring it up. Let's see how we can help each other here and there. What do you say? You say now, today we are dealing with principles, not the principal of a school. Hey, my friend boss one, the real procurement manager himself is in the house. The real procurement manager, boss is in the house. Makofi, yake I'm saying, clap for our boss one. Boss, thank you for coming. Please continue helping me to post the links here. I want everyone, Rogers, Judy King, everyone, even our new friend Rosanata TV, all of them, we mingle by giving a subscription. Yes, and you watch. Let the people see that we are helping and we are giving each other hours. When I say hours, I say one of us. Hours. Blessings, everyone. This is Benjamin, the wise guy, the doctor himself. Now we continue the topic. Now I'm going to give today. We are going to talk about the principles of management of heart conditions. The principles of management of heart conditions. The principles. We don't just start by treating heart conditions because you feel a pain in your chest. This one is not a heartbreak. This one, he needs an injection. Then we give you an injection. No. We don't just think you have hypertension And then we think this one needs some antihypertensive because maybe this one has a stress. No, there are some principles of management of heart condition. Thank you so much, Boss One. Blessing to you all. Blessings to what you are doing, sharing those links on the platform. If you have not followed any platform around those that Boss One is sharing, please click and link up with those platforms. Now we continue on principles of diagnosis of heart conditions. How do we diagnose heart condition? We just don't wake up and then we start diagnosing. Because you are seeing someone is feeling like is having chest pain, you start diagnosing. Ay, my friend, no, it doesn't work like that. Now, the first thing that you have to check on a patient, the first thing that you have to check on a patient or a friend or a relative that you have at home is one very serious one is called detailed patient history. The protocols at recurrence every day, reoccurring every day while you have that patient at home, while that patient is at work, while that patient is interacting out there with people, and while that patient is working for himself anywhere and any place. That is what we call detailed patient information. And not forgetting the previous diseases and familial diseases. Now, this is the most important first step in diagnosing a patient when you start suspecting heart conditions. Chest pain. Pain. What is pain? Have you ever asked yourself what is pain? Pain is something that is good in the medical field. And I'm not saying good to say that to a patient is good. No, to a patient, it is not good. But to the medical practitioner, it's a groundbreaking starting point of what to do. So, what is pain? Have you ever asked yourself what is pain? What is pain, my friend? And where is this pain coming from? Is this pain from your ears? Is this pain from your heart? Is this pain from your legs? Where can you get pain? In your abdomen also you can get some pain. Guys, if you've not liked and subscribed, it's the time you should tap, 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 tap. Say, Benjamin the wise guy is making noise. Yes, I make good noise, you know. I make good noise, my friend. I make good noise. Hey, and if you know I make good noise, come and tell us your noise is fine. Now, we're talking about pain. Pain. Pain is unpleasant physical or emotional experience that signals something may be wrong in your body, either physically or emotionally. Listen to that. Very fine, very fine, very innovative of that person who said this is pain. Hey, smile in the city. Greetings, Dr. Benjamin, and blessings to each and everyone. Smile in the city has brought us smiles. That means serotonin and dopa hormone have been released from your brain. And now we can see smile in the city and we smile and we feel good. Good, 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 good. Today is a good day, my friends, my relatives, my every person who is in the house. We are talking about how to heart conditions. We have started by, and imagine this is what I'm saying. Pain is unpleasant physical or emotional experience that signals something may be wrong in your body and or in your mind, either physically or emotionally. Emotionally. You know, emotionally, we are not talking today about emotionally. We are talking about physical. Because if it is physical, it means the heart is suffering. So the first diagnostic center of heart conditions is chest pain. Chest pain. Chest pain is the first thing that you should look upon. I've said in a medical practitioner, pain is a good thing, but to a patient, it is not a good thing. Why? Because pain guides you on where to start from. So we have said that pain, 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 pain should be from the central. Any heart condition that has a problem and you are feeling pain, it is central chest pain. Hmm? Suggest coronary artery disease. And why? Because now I need to change back to my other heart. This one. This one. Because if let me remove this one, it is obstructing. It is obstructing. It is obstructing the culmination. It is obstructing the culmination and the good of my office is full of papers. But it's okay, we are learning. So if you're coming in right now and you have not subscribed, please subscribe. And please, another thing, don't leave without giving a like. Eh? Don't leave without giving a like. Ahem. Coronary heart disease, carotid. They come back to the heart and they give, as the heart is pumping and relaxing, it gives oxygen and nutrients. From the outer, it comes back here. So when there is a problem, either coarctation or constriction of these coronary arteries that come back to the heart, what happens? The person feels pain because now your heart is not getting enough oxygen. Who is not? This that was not subscribed, man. And you have not even liked. Like, please. Give likes, give likes. You know, likes gives impression. And if you have any medical issue that you want to ask, the chat is there. Please give us a question. Let's understand your question and let's help you to deal with your question harmoniously. Harmoniously. So let's continue to give likes. Let's continue to give likes. Now, we have said pain of central chest pain may be suggestive of coronary arterial arteries. Give oxygen to this heart of ours, a very beautiful heart. But now, maybe the coronary arteries have constricted or they are having blockage. So they are not passing blood in this heart the way they should. So, you see, first thing you have asked is chest pain. Mhm. The second thing, shortness of breath. Eh, shortness of breath in medicine is called, anyone who knows that shortness of breath in medicine is known as what? It is known as dyspnea. Dyspnea. If you see a doctor saying the patient has dyspnea, you know it is shortness of breath due to heart condition. But let me tell you something. It is not only when a person has heart condition that he can get shortness of breath. So we are going through all the symptoms that can be there that can show someone this person has shortness of breath. Is when you feel unable to get enough air because the heart is not pumping effectively. You see, we say it. In medical term, we say reduced cardiac output, increased pulmonary pressure in pulmonary veins, especially seen when the right ventricle has hypertrophy. Hypertrophy is when the right ventricle is bigger than normal. Yes. So please, before we continue, I can see they are getting in. If you get in, please hit the like button. Let me see you do your thing. Hit the like button, please. Let me see you through. But I like questions, even if it is not about cardiac issues, even if it is out of topic, but it's a medical question. Please bring it up. Let me and my group here and my friends here know how we can tackle it. Now, shortness of breath, palpitations, palpitations. Hi everyone, Angela. Angela is telling us hi everyone, and we have to respond to Achieng official and say hi Achieng. Hope you're doing good. Thank you so much for joining in the platform. We adore you. Please hit the like button as you watch. Now, we continue with palpitations. Palpitations is a sign to show that someone is undergoing what? Arrhythmias. Arrhythmias. Arrhythmias are, I said, are irregular heartbeats. Heartbeats. Boom, 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 boom. Fibrillation. You remember our topic? Fibrillation. Arrhythmias may indicate palpitations, like palpitations. Some people don't know palpitations. When you feel your heart is beating consistently and it's beating hard, and you can feel it. That one is called palpitation. Palpitation. And then we have another term that is called syncope and fainting. Could be due to arrhythmias or valvular heart disease. Syncope. Now, if the general population knows about fainting, but the doctors themselves, they know about syncope. It is the same thing. Syncope and fainting is the same thing. Yes, syncope. And it is because when someone faints, it means that air, oxygen itself, they are reduced in the red blood cells that are perfusing in your brain, or you have low red blood cells that are going to your brain. So your heart is unable to do the work as needed. I'm giving you some symptoms that you can see and signs and say that this person, we are at home with this person, but there is a problem. Hmm? This is how we diagnose. Leg swelling suggests right-hearted. I explained that so well. If you have not been on the channel, please, there are so many videos explaining about this. Leg swelling, suggestive of right-sided heart failure. Right-hearted heart failure, return to the heart is low. You check it, the ventricle is not pushing enough. So the flow of blood that is coming in may not be normal, and the flow of blood from the left side, the left side of your, the right side of your circulation may have a problem. So you get leg swelling. Also, there are some things that you may look. You see, you may be having someone around you. You may be having someone around you, and this person is having hypertension, diabetes, and has been smoking. Has this person come from a family that have history of heart diseases? But because you saw things like congenital heart complications of the heart, they are related mostly to genetics. Is this person having a very funny lifestyle, like drinking continuously and also taking foods not harmoniously, indisciplined in eating habits? Is this person presenting with chest pain, shortness of breath, palpitation, syncope or faint, or leg swelling? Hmm? Have you ever seen one of your friends having this kind of issues? It is very important to note things down and note these things that I'm saying. Physical examination. Have you examined that person well? Yeah. Now, these are things that now you look and you touch. Check it out. Check it out as we continue. Our boss in the house, boss one himself from Nairobi, the real procurement manager of a very good company that is coming very soon. Boss one has dropped there the links, so many links, and I want people with good heart, have good heart. Please follow the links. Miss Marie, please follow Barbara, please follow Judy, please follow Gilia. Smile in the City is here. Check out what these people are doing. It is soothing. it is educative, and it is nice. We like nice things from nice people. Please don't fail to do that. Check these people out. Let them enjoy your time as you enjoy their program. As much as we do that, there is someone very important from Jamaica, but coming out of the US himself, Jamaican uncle, the father of true love, the father of love and unity and peace himself. If you have not seen Jamaican Uncle channel, please drop by, check out Jamaican Uncle's channel. Tell him I'm here by side from Benjamin the wise guy himself. You see, that is how we do our things here in the streets. Down, thanks Jamaican Boss One for dropping that link of Jamaican Uncle himself. Wow, that was a commercial break. Let's continue and see the problems that we have, how we can diagnose them, and how we can see that this person has a problem. We need to rush this person in hospital immediately, because people die in homes without knowledge. Now, get it, grab the knowledge, put it, store it, and never erase it to the dustbin again. Check this out. Physical examination, a structured cardiovascular examination. Structured, not just hitting someone with slaps and telling him, can you take some milk? No, let's get down step by step and listen to this. General inspection. General inspection. Thanks for those likes that are coming. I adore you subscribers for giving me those subscriptions and hours and likes. I love you all the subscribers that are here. You know, general examination, general inspection. Check out if this person has cyanosis. What did we say cyanosis is? When your red blood cells lacks oxygen, it turns blue. So you will see it around the lips, around the palms. Those are the signs that this person is not getting enough oxygen to the red blood cells. Pallor and anemia. You look at the conjunctival here down. Look at mine. Look, mine is red, so I don't have pallor. Are you seeing the red coloration? Are you seeing how it is red? But if you check at some people, you will see a pale red, pale pinkish. You know that this person, hey, Betty's World. Betty, welcome. We thank you for tuning in. We thank you for being here, Betty. Hey, our mom is here. You know, if you want to make good uniform, and you are in Jamaica, always tune to Betty's World. Visit her channel, you will see what she does. Very good things there. Very nice presentation. We thank you for tuning in. Pallor. General, I've said you have suspected this person might be having heart condition, but now you are inspecting general. You get cyanosis. We have said blue lips and sometimes palmar cyanosis. Bluish. Pallor, anemia. Check, just push down like me, I'm pushing. You see I'm pushing and you can see some redness and whitish. Now the red, in some people when you push, it is not red. You will find some pinkish. Hey, I wish I could clap my hands and say, welcome to the house, Hilda Taylor. Hilda Taylor, welcome to the house. Welcome to Benjamin the wise guy, the host of the session. I just host and I want you to help me with questions and then we discuss. Look at that. Nice one. Nice and fine. Hilda Taylor is here. We adore Hilda Taylor, our friend. Now, let's continue and say edema. Those are the general signs that you should look at when you are inspecting someone. General of heart disease. Cyanosis. We have said bluish lips and palms. Pallor. Pallor means he's anemic. For anemia, look at the eyes, look at the palms. Are they pale? Edema. Is this person swelling from fluid retention? Look at the legs. You press the legs like this. CJ Rehab, Dr. B, hello. Yes, I'm here, CJ Rehab, and I'm really taking through the people as the pilot of the day, telling these people and discussing with my people how we can suspect and know that someone is having a heart problem. So if you are coming in right now, you know what to do. As always, we our if it is in the church, we give some token for appreciation of the what can I say, of the church as a whole. Here we give a token as appreciation by giving a like. A like. Thank you. CJ Rehab, Hilda Taylor, welcome to the platform as we continue. Now, those are the three major signs that you should look at when you are examining a person: cyanosis, pallor, and edema. Cyanosis means this person is bluish, he is lacking oxygen. When red blood cells lack oxygen, they turn blue. Pallor means he is anemic. There is no reddish discoloration anywhere, even in the heart. Edema means fluid retention. Even the legs are doing what? Are swelling. And where does fluid retention come from? We come back to our hearts and we check the pulmonary flow of blood. There must be a problem somewhere here, either in the valves or in this pulmonary flow, or the muscle that pushes the blood away from the heart. Now, this person, we have already checked. Maybe you have found that this person has edema, pallor, and cyanosis, all of them combined. What do we do next? We check the vital signs. Vital signs of a person's life are what? Uncle, good morning, naf, love, and blessings to you. Blessings to you, Hilda Taylor. The vital signs of a person's life is one, the blood pressure. One is the blood pressure. The blood pressure is the one vital sign that you really need to check out and check if this person is okay. Is he having a good blood pressure? You may find it's elevated or it is isolated. You see, there is two different BPs, elevated and isolated. So isolated, we say it is the bigger difference between the systolic and diastolic. The systolic one is higher than normal, but the systolic one may be normal or just a bit high. That is called isolated, mostly found in old age. Old age. How do we manage it? We will know. Now, pulse rate. Check the rhythm and the volume and the rate of what? Blood. How is the rhythm? Is it tachycardic? Is it tachycardic? Tachycardic means, is it beating irregular, high or hypo? Bradycardic. Bradycardia means, is it beating at a low tone? Roger Skillia, my friend, thank you so much. I saw in your channel you are bringing us people from away. Roger Skillia now is becoming internationally. Yes. Today's morning, Dr. Benjamin and friend supporters, we thank you, Ridley, for being in the chat. Thank you so much. We welcome you with open heart and open arms. Come in and say that we love people from Jamaica. Everyone in the world, Hilda Taylor, Ridley, Jamaican uncle, Betty Swald, these are people blessed with good heart from Jamaica, but all of them are staying away, maybe in the US, maybe in Australia. Very soon you will see Ridley coming and owning a house here in Kenya, and then we say, one love, one heart. Let's get together and feel all right. That is it. Now, we have gone to vital signs, the blood pressure and the pulse rate. Very important, because if this person is having isolated hypertension at old age, we will know that the left ventricle, even without doing anything, even without taking an ECG, even without doing anything, let's get together and feel all right. That is what Ridley is telling us. Yes, I attest to that, Ridley. pull up that thing again and say, let's get together and feel all right. So if you're coming in right now, my friends, you have not liked, please just like me. Like me, like the platform, because this platform is not me. It's the people who are texting on the chat. You see, because we interact and we counteract and we do help each other to solve problems. So try like. So we are going on with physical Ali Mig TV. Ali, I received your contact. I received your contact is because I'm busy, but I'll uphold my tax. Ali Mig, welcome to the platform. I'll salute you and I'll do whatever I'm supposed to do and I will make you smile. Hey, doctor. Hey, baby. Today you are here. Say hi to my fellow friends. Don't hide behind bars. My baby is here today. I like it when she's following me and telling me, hey, stop making a lot of jokes. Go back to business. She usually tells me that, go back to business. Stop making a lot of jokes. You know, you are a joker. Now, let me get back to business. Now, that is, we are 19. Let the likes flow. Let the likes flow. Let the likes flow. So, Alimik, wait patiently. Waiting for you patiently. Girl, I'm happy that you're mine. Wait patiently. I will add you and you will feel the nice of being with others. Now, the niceness. Now, here we have vital signs. We have talked about what is your baby link. She doesn't have a channel. She is so shy, but I'm going to tell her to start some channel. I'll discuss with it with her. She's here. Brothers, sometimes I'm overwhelmingly happy when I see you and I see Betty C 1860. I even forget we are having something. Now, we were talking about physical examination of a patient who will suspect you are at home and you are suspecting that this person might be having a heart condition. Physical examination first, a random one. Is this person having cyanosis? That is general inspection. You just inspect the body. Cyanosis is bluishness on the palms or the eyes. Thank you for the song, Benjamin. I made for you. Oh, Alivik, thank you. I like singing. And pallor. You check the pallor. Pallor is the reddishness. A person looks anemic. Even the reddishness on your palm is not there. Fluid retention, and then the vital signs. Yes, the vital signs. You check the vital signs by checking the blood pressure, and pulse rate, rhythm, and volume of this person. Yes, those are the most important, the first things. If a person has been having hypertension or everything that we've been talking about, and you see this person, you should check on general inspection, the three things. I'm repeating because they are very important. Cyanosis, pallor, and edema. Cyanosis, I've said, is bluishness. Pallor is anemia, and edema is fluid retention. So when I'm saying pallor, you check if this person's at the conjunctiva, if there is bluishness or it is pale, there is no redness. Look at mine. You can see some redness. You see, but for a person who has heart conditions with low blood cells, it will be red, pale, no, whitish. So it will be bluish with whitish. You get it? And then check the legs, check the face. When a person is having a puffy face all of a sudden at night, we know that, hey, Betty, today you've met your namesake. Now say hi to your namesake. I can see you've met her today. Now, let's go to vital signs. Those are blood pressure, pulse, rate, rhythm, and what? You do rate, rhythm, and volume. Now, there is a very important part in this now. Very important part. Yes, cardiac examination when it comes to the real examination of the heart. You know, we call it cardiac examination. cardiac examination. How do we examine a person's cardiac? Now, cardiac means heart. And now we are at the step of examining the cardiac system, the heart itself. Because you have noticed that this person might be having a problem and you strictly want to save life so fast without thinking A, B, C, D, where is this? I want to rush this person to hospital. And as you are rushing this person to hospital, you have checked, you have inspected, you have seen he has cyanosis, pallor, and edema, and the blood pressure is raised, and the pulse rate is beating so hard, not harmoniously, so fast. As the ambulance comes, or as you place this person in your car, or you are carrying this person rushing to a hospital, what do? Observe pericardial. Pericardial, someone may say that this is a very strong word for a medical person who is not a medic. Listen, pericardium is front of the chest over the heart, the sternum here. Observe here. You see when people go to the gym and they feel they are becoming energetic and they want to show us I do gym and you see my chest is bigger. We say they are showing us their pericardium. Their pericardium is here. So you check the pericardium. Look for visible apex beat. Apex beat is here, down. Sometimes when you have a very constrained right ventricle problem, this one beats so hard because the heart is lying like this. You will see it here. Yeah? Here. Is someone looking at me and seeing what I'm pointing? Let me point again. Here, the heart lies like this. So this is the left. You can see the left ventricle, the right. So like this. Just hear the voice. Don't look at my face. Look at my hand. Let the hand do the talking now. The heart is like this. And now, when the right ventricle is extremely hypertrophied, it comes up to down here. So when it is beating like this, fifth intercostal space here, you will see the apex beat. If like this, see, now this is the normal, but the right side has hypertrophy. It's big, so it comes up to here. So when it is relaxing and constricting the heart, the ventricular muscles, they beat, and then you see something here that is beating, and like you see, these are normal things that you can expect, not even a doctor, and say that this person is having a problem. Now, as the ambulance is coming, you are strictly looking at this person, inspecting the heart, the beat of the heart. You look there, you see something is beating there above. Know that is the apex of the apex beat is this. You see this tip, this is the apex. So you will see it beating from, hey, my sister is here. Maggie, Margaret in Norway. How is Norway? Today I saw you coming from the gym and I felt so nice. Now, people, let's follow my sister Margaret in Norway, not just in subscription. I want to give you something. I want to give you a hint. Let's not just subscribe to Margaret in Norway. Let's follow her walk and talk. Margaret in Norway tells people, let's go to the gym, and she goes to the gym. Today morning, I saw him coming out from the gym. Imagine, that's why I say YouTube and media is good. Imagine I was able to see her coming from the gym, and she's in Norway, I'm in Africa. That is the real interaction, knowing that your sister is doing fine and feeling nice that they are doing fine. You see that? So let's follow Margaret in Norway and follow the steps of Margaret in Norway by doing exercise. Margaret in Norway gave me a question yesterday about exercise. As I finish, I'm going to talk what exercise does to your body so that people can understand. We don't just go to the gym to do exercise. We don't just go to the gym to do exercise. We go there for many issues. Now, we have talked about you are inspecting the pericardium and you have noted that something is beating down here. Abnormal pulsations, heaves or lifts from the veins and the around the chest, you may see somewhere is pulsating like this. You note that down so that when the doctor is there, you'll tell that doctor, I've noticed the upper beat is beating. I've noticed there is a pulsation here, to save life. You see, chest symmetry movement, very important. Now, the world is now small, very small, my sister, very small. Very small. When you went to Norway, you never knew we will interact like this. But you see, we are interacting now. And I've known another family from the US, originated from Jamaica, that's a family of Jamaican uncle out of Jamaica. And one of our greatest elder again, Betty. Betty. Coming in right now, the like button is always open. Button, and we say one love, like say one love. Now, we have talked about the pulsation, but there is one very important thing that we really need to talk about: chest symmetry and movement. When your chest is beating, now I'm talking like a like a neighbor, that your chest is beating. When your chest is moving up and down due to respiration, your stomach should be going the opposite direction. When someone is breathing in, the stomach should go up. When you are breathing out, the stomach should go down. But there is something very funny at times at heart failures. You may see someone is breathing in and the stomach is going down and the chest is going down. When you are breathing out, both of them are going up. Paradoxical, it is called paradoxical breathing. That is a life-threatening thing. Mostly people with this kind of breathing, they are people who have got traumas. They have got traumas. So abnormal finding may suggest cardiac enlargement or hypertrophy. So as you check this person, getting him to hospital, and you see that, you increase your pace to go to that hospital. You don't start stories to tell people on the road that, oh, we were that good at home and it started, please help. No, the help will be in the hospital. You do faster get to hospital, because now Dr. Ben has made you a real good doctor, and you go and watch good doctor. A real good doctor, a doctor that can handle emergency, but by watching this video and interacting with some people, you have gained knowledge. Rush that patient to hospital. Stop talking to people in the road that trying to tell them to help you, because this person has a paradoxical breathing period. Paradoxical is when the heart is going down, the stomach is going down. The heart, the chest cavity is going up, the stomach itself is going up. It means cardiac enlargement, or there is trauma. Some blood vein inside has broken up, and it's getting blood to the cavities of your chest. So it's not time to stand at telling stories. It is time to go faster to a doctor, an experienced cardiologist, to remove the cavities blood, tap where it has a problem, and put the patient on intubation so that the blood cannot go through the lungs. Thank you so much for listening to that point, because I know one day you will save life and you will smile home saying that today I've saved life, even if I'm not a doctor or I'm a doctor, today I've saved life. You see that? Fine. Very nice. Saving life is very nice, my friend. Well, let me tell you, when you are in a hospital and you save life as a doctor, it is an emergency. You go home while smiling. What do you want me to say again? What do you want me to say? Tell me, let's continue. Yes, let's continue now. Palpation. Now, you have checked the visible apex beat, you have checked abnormal pulsations, you have checked the chest symmetry. Now you go to touch. Because the doctor is not around, or you are a medical student, or you are not a doctor, or a doctor is there, you can tell this doctor again, do this, I want to make sure it is. Palpation. We start by inspection, you go to palpation. You palpate. Where the apex beat is, the fifth intercostal space, mid-clavicular line. Here. Fifth intercostal space, you are not seeing. Let me show you. I'm using this, and this one is behind me here. Let me use the diagram so that we see. Fifth intercostal space, mid-clavicular line. 1, 2, 3, 4, 5. Here at the chest, mid-clavicular line, clavicle. You check this clavicle. This is called the clavicle bone. So half of it comes to the mid. So if this is a person, you check, you do this, your hand, you check. Look, my fellow friends, you do this, your hand, this, you check the clavicle bone. Now I'm checking this bone here. And then what do? You get half of it, half of the clavicle, and you come down to the fifth bone here. You get? That is called the mid-clavicular line, fifth intercostal space. Displaced in cardiomegaly. So if you have cardiomegaly and you have a big heart, the apex beat will not be there, it will be down here. It will not, you see, my friend, let's talk, let's listen. Let's listen silently. Fifth intercostal space means this bone. From this clavicle, you start 1, 2, 3, 4, 5. Fifth intercostal space is here. The space, not the bone. You go to the space. And then you have said mid-clavicular line. So this bone that is holding mine here, you do like this, you do this, and then you say half of the mid-clavicle, then you drop here. So look at where I'm pointing. I need a very good camera now. You see where I'm pointing here, because it is 1, 2, 3, 4, 5, then the space. So I have gone and said mid-clavicular line, the clavicle mid, drop up to here. That is where your normal apex beat should be. Your normal apex beat, this one, the beat, the normal apex beat should be. As your heart is beating, you should feel it here. But when your heart has a problem, you will feel it more down or more pronounced away from the mid-clavicular line, away. Character of that beat. How is the character of that beat? Heaving, pressure load, thrusting. Heaving means thrusting means you can put your hand and you are feeling those things. And then you can feel thrills, palpable vibration. Sometimes when you touch down there, you are feeling, you can feel it when you tap, and you can feel the thrashing, indicating loud and hard murmurs. When the murmurs heart, the valves of the heart, you are coming from these valves. You are feeling them by your hand. Just common in valvular diseases, because when the valves are vibrating, you will feel it on top of so you touch that person of yours, the person you are trying to help, the person you are trying to save life, you touch that person and feel that the person does not have the hives. You get it? Seeing severe mitral stenosis, mitral valves, this is the tricuspid, inferior mitral valves, this side. Severe mitral valves, when they vibrate, you feel them. Now we get to a hospital. You have done all that. You are in a hospital now. The professionals are there, and you meet Dr. Ben. You meet Dr. Ben there with the white coat, or the blue that I put on, with the stethoscope, very ready to work and help your person to live again. You meet me there, and I tell you, thank you so much for bringing this person. Let's take it from there. And then we start again. We inspect everything that I've been talking about. But the third step is for a professional. We call it auscultation. Auscultation. Listen with a stethoscope at key valvular areas. Now, some people don't know what a stethoscope is. It is a Latin word to them. It is a Greek word or forgotten word in Latin. A stethoscope is this. This is a stethoscope. At least I've found a stethoscope. This is a stethoscope, but this one is a student stethoscope. Yeah? The one that students, when they are taking, they are in medical school, they want to show that we are medics. We are the people that will save your life in future. They put it here, work with it. Yeah? And me, I'll be there with it again now at the emergency area. You take and you have examined. We have inspected. We have inspected. If you are coming in, my guys, and you have not liked, please press the right button. And my people, the links are not dropping in. Please drop the links. Drop the links. We want to follow. Don't get tired. We want to follow our sister Barbara. We want to follow our sister Margaret in Norway. We want to follow Jamaican Uncle Betty's World. Everyone that is here, we want to follow them. We want to know what they are doing, everything that good that is in their channel. Please drop the links. Don't get tired, my moderators. Now, you are there watching. This is what the doctor does. He has inspected the way I've talked about. He has done palpation the way I've talked about. And now it is auscultation. Now, at auscultation, you take this. This is the stethoscope that I'm using, but this one is a student. The other one someone has taken, has gone with it to work. Now, S1, the first sound of your heart, closure of mitral and tricuspid valves. The closure, one, is closure of the mitral, the normal. Now I'm talking about the normal. Yeah? I'm talking about now the normal, what the doctors hear in those stethoscopes. You get it? The closure of the mitral and tricuspid valve. So when the doctor listens to the stethoscope, and this doctor listens keenly, he hears the first sound. We have examined. Now we are. A minute, my guys. My something is going haywire. Where is this? Oh, auscultation. Come on, we were on auscultation. Now, the first sound that this person will listen is the closure of aortic, this one, these two valves, mitral and this one. Says tick. That is S2. Lap, dap, the heart beats like do. And then closure of aortic and pulmonary. So this one and this one closes, and this one and this one opens. This one, the two open, they close. They open, they close. They open, they close. So what the sounds come like this: lap, dap, lap, dap, lap, dap. You get it? As the blood is flowing, lap, dap, lap, dap, lap, dap. Then closure of aortic and pulmonary. So they close like that. And then extra heart sounds may hear. extra heart sounds may come along. And how might the extra heart sound come along? You know, sometimes when you have extra heart sound, listen to with the stethoscope at the key levels. Now, extra heart sound may be early distal. Hmm? Early distal. The heart is resting so early than needed. It means there is a problem with signaling of your heart. That's where we come back to our pink heart. You get it? Late distal. It means, you see, when your heart, the S3, you have S3 and S4 because heart sounds are S1 and S2. Lap, dap. S1, S2, S1, S2. But you may hear S3 and S4. After lap, dap, you hear another one, dap, dap, or ooh. You get it. After that, you may know that early diastole means volume overload. More maybe the heart in the right side, there is fluid, pulmonary edema, and there is fluid loaded there. And S4, listen to how I'm putting it. If you are coming in, people are liking. If you like, please like. If you like, please like. Now, lap, dap, boo. Lap, dap, boo. The normal is lap, dap, lap, dap. So you, when you take your stethoscope and you are listening to the heart as a professional, you are listening to lap, dap, do, lap, dap, do. You get? So is the S3 and then do is the S4. Those ones are pathologic. They are not supposed to be there. What we need is when I'm auscultating my person, I put a stethoscope here. I put my stethoscope here at the fifth intercostal space here to hear the apex beat. I must listen to lap, dap, lap, dap, lap, dap. But now I'm feeling there is something called lap, dap, boo, lap, dap, boo. So, no, that one is a pathologic sign. It means maybe there is fluid overload because when lap is dapping, hey, hey, my friend, explanation sometimes can end up to go somewhere. Hey, when lap is dapping, there is a lot of fluid in the right ventricle that even the valves are not ready to hold, and there is some fluid is supposed to come here. So you hear like because most of them is being pushed and coming back, and then boom, that is overload. S3 suggests there is an overload. Late distal. So when you have boo, the late one, the one that you are hearing boo, you will know that the stiff ventricles, the ventricles are this. So you will get that it is taking so long for these ventricles to contract and relax. And that one takes time before these are closed. Because, you know, they are supposed to push. So when blood is going and these ones are bringing blood to the ventricles, the lap ones, the lap, mitral, and you see, lap. The lap, when they are bringing, you see, these ones are taking. You get it? When they are stopping, this one are bringing. So you see, it means that this one is taking time to push. And as it pushes, it is stiff. It takes time before it comes back to get more blood. So it means the time is longer. So this one cannot close if this ventricle has not come back to position. So it means what? Takes time to come. Late distal. The S4 is a late distal diastole. A late diastole that you hear. Ventricles are very stiff. You'll know that. Now we are learning, and if you have a question, as I usually say, please bring the question down. We are learning how to diagnose a patient who has heart condition and save life. Mamas caused by turbulent blood flow. You see, if you have mamas in your body, if you have not liked my people, please like the session. Let's get on and like and like and like. Mamas, even in a flute, I want to use this paper. I want to use this paper so that you can listen to. Soon I will, doctor. Yes, doctor. Boss are saying soon, soon, and very soon. That is the day I want to see you. Don't say soon. Start now. I don't know how to make a flute. I want to explain something about the valves. You see, when let me put this like now, when blood flows and these valves are weak, they vibrate. They vibrate, and when they vibrate, we are causing a turbulence in the heart. When they are causing a turbulence in the heart, I wanted to try and make a turbulence with this paper, but let me say that this one is my valve and it's weak. So when you push blood, it vibrates. It vibrates. You get it? It vibrates. So assess the timing. The doctor will assess the timing. Where is the location? Is the location coming from the right side or the left side? Is the location specific, anterior, at the mid-clavicular line, at the apex level, or sideways? So that he can specifically know where he can go deep and examine more. Radiation, where is it radiating from? Is it radiating from the left or the right? It's very important. How is the intensity? Is it high or low? Example is when you have mitral stenosis. Mitral stenosis means the valves of the mitral valves are, you remember, they are small and short, and we say short and round or short and kapumpu. They are short and they are constricted. Stenosis means constriction. So when you have mitral stenosis, mitral stenosis. What does mitral? I really need people to understand this medical term. Stenosis is a medical term for abnormal narrowing or a passenger of opening in the body. So mitral stenosis means abnormal narrowing of this. Yes, thanks for those who are liking. I can see the likes are continuing and continuing. If you are liking, thanks a lot. Be blessed. If you have subscribed, please thanks for me. Thanks a lot for everyone who is watching. If you have not subscribed, I know you forgot. Please subscribe. I know you forgot. Please subscribe. Don't let Benjamin the wise guy just be like that. Get the subscription so that you can intensify the impressions. And if you have not subscribed to anyone who is in the list here at the chat, please subscribe to them. Now, we have said in mitral stenosis, diastolic murmur. You get diastolic murmur. Diastolic murmur is when the heart is resting. You see, so when it is pushing through, when it comes back, that is what, when you get, you see, mitral stenosis. Let me explain so slowly. When it is pushing, it is systolic. But when it is coming back, you will hear the murmur because blood is pushing through the mitral and right atrium, the tricuspid valve. So when it is pushing to come and rest, that is where you feel the vibration from the mitral valves. You get it? Yes. Yeah. That is where you feel the Ritsu. Ritsu is in here. She has come to see doctor, to check on doctor. Yes, Rich Sue and the friends and our friends that are here. Rich Sue, thank you so much for. I'm delighted. I'm delighted, my lady, for you being in this chat. And Rich Sue, now that you are in this chat, I have the honor of giving you a red blue jacket. Hey, let me see. Rich Sue is here. But I have the honor of cutting this topic short to introduce my big sister, my sister who my daughter loves so much, who is called Judy Moyo. Judy Moyo has said, hello, Dr. Benjamin, here listening in the background, but still waiting for the dollar sign on your channel. It is coming soon by the grace of God. Judy Moyo. Now, let me welcome everyone, and I'm so delighted having Judy Moyo here. Judy Moyo, I call her the discipline master. Let me get a commercial break before I continue. Judy Moyo does not joke. If this is wrong, she says, I don't like it. If this is right, she says, I like it. So Judy Moyo is not a YouTuber, but suppose anyone that is a YouTuber who is a positive YouTuber, because she knows I'm a mother and this person has the potential to do great things, and that's why he always supports, from Team Amarwa to everyone, to Jamaican Uncle, to Rich to everyone who is positive minded. Oh, Judy Moyo, Judy Moyo. Judy Moyo, what can we say? We can only say that God bless you. God bless you with that disciplinarian heart to make people know that this is the right thing, this is the wrong thing, and we love you so much, Mom. We love you so much. I can see even Jamaican Uncle wants to smile. Hey, wants to smile and feel good. You see, when you are talking and you are seeing your good friends in the house, how do you feel, my friend? How do you feel? Ah. Hey, my laugh has told you. And Judy Moyo, your friend always tells me she wants to talk to you. She likes how you discipline people on channels. Miriam Mumbwa, thanks a lot for being in here. Thanks a lot. We have talked a lot about heart conditions. And today is the day that we want to know how we are managing a person who has heart condition, and we are coming to get to know if this person has a heart condition or not. Remember, we have talked about heart conditions to even the children that are not born, children that are still in the womb. You see, life starts from conception. So I've dealt with even the children that are not in the womb. Marjay B, yes, doctor, we love Judy Moyo very positively. Judy Moyo, listen, people love you. People love you so much. Alimig is still here. We thank you for being here. We love you and we thank you so much for everything. Now, often, Alimig, today I dedicated a song for you. Now, we have done our auscultation, we have had mamas, we have done all that. And then we go back. Dr. Benjamin, I will come to Kenya just for stopover in May for 12 hours. I'm booked at a hotel and I will let you know so that you can bring my friend. Thank you so much. Please, I will. I don't know how I can leave my WhatsApp to you, but I will give you my email address or my Snapchat. Not Snapchat. I have Instagram. My email address is Benja. I always am told to say hi to Judy Moy, Benja Okwesh at yahoo.com. That is my email address. The more you can drop me there your contact or your Instagram or anything, so that you can, or anyone who wants to have a medical talk, I'll pin it. The more that is the email address. Now we are continuing principles of treating, of getting to know how a person is. Now, we have auscultated, we have inspected, we have found the blue correlations, we have seen the fourth and the second, the first, second, and the third, you get it, and the third noise, I call it noise, vibrations, yeah, in the heart. And now it is now to take this person to find out if Margaret in Norway, my sister, thank you so much for being here. And Judy, thank you so much. It is now time to go and find out what this person is going about. Please tell Judy Moyo we love her so much and we want her to start another channel for herself. And all of us, we will go there and we will tell Judy Moyo we want you to be monitored in 3 days. We will we will rush there, every one of us. We will mobilize everyone to go and make Judy Moyo. Judy Moyo is a good-hearted lady. And I said, when I call someone a lady, you know what I mean. Empress number one, girl, I wanna be with you. A real woman, yes. Queen of the motherland. Hey, Empress number one. Big up Richie Spice for that tune, because when you sing to a lady like that, it means you respect that lady, you give that lady 100%. 100%. What? Respect and love. So we love Judy Moyo. So true. Big up to you, Judy. Big up to you, Betty C. Judy Moyo has supported so many people in Africa silently. Let me stop from there. Now you know what Judy Moyo means. Judy Moyo is heart of gold. The heart. The heart. And you're talking about the heart. Moyo means the heart. So you know she's a good lady. And she's not a YouTuber, by the way. She just supports good content. So if you are here watching me and you have a channel, big up, one love, like Jamaican uncle, give us positive vibes. Now, I was saying something. You remember when we talked about PQRS? You go to a hospital and then you see some things that are coming like this. You remember this? Or you check out watching from Rochester, New York, blessing doctor and everyone. If there is a lady who I watch and I get inspired, sometimes I see people and I forget I'm teaching or I'm giving advice. Queen is the lady. I turn on my TV and I'm home, and she's just giving some good vibes, giving us quotes from the Bible, telling us how we have to live good. There was a time, before I continue on these lines, let me give you this story. Just a story of 1 minute. I got home so late, so stressed because of a patient. I always want patients to be good. Then I get home, I sit on my couch, found my children slept, and always my wife waits for me. And she's asking me what's up. You look tired. I said, yes, I'm stressed out because something in the hospital. And I took the remote, and Queen C NLB was at her life. Whatever she talked about felt me smiling. My spirit came back. I took a shower. And this morning when I went back to hospital, the patient that I was thinking about, God had come through. My people, the online media like YouTube, the people we meet sometimes can change your life without even you personally noticing it. Please visit Queen CNLB to get motivated. and feel the mental health pressure going down. You understand? Queen, may God bless you. May God make you continue with that vibe. I thank you for your channel because that day you helped me mentally, even if I'm a doctor. Thank you so much, Queen. Now let's get back to this. You go to electrocardiogram. I think I don't have one that I can push it here. I would push it here so that people could see. They usually say when I'm looking at that thing, I'm seeing lines that are going like this. Now, electrocardiogram is what checks your heart. Now, today we must finish how to diagnose so that tomorrow we start taking the beta pills slow by checking in. Now, I'll bring you back to this. Is that machine that you are placed in your chest with the electrodes, and then we place one here, and one on the foot, so that it can read the electric pulses that are coming to your heart. So this one is an example of illustration of where we place those electrodes. You see, one is placed here, it's called the V1. One is placed here, it's called the V3, V2. You see, and all, they are reading this heart. The electrical conduction of sinoatrial node, the electrical conduction of atrioventricular node, and the bundle of this, how the electrical is going. So let's see, if one is placed at the V1, it will be monitoring this area, how the electricity is coming. So you remember when we said this, I'm just giving an overview of electrocardiogram. The P wave is telling us the ventricles, the sinoatrial node is depolarizing, and the ventricles are contracting, so it is pushing blood to the right ventricle. This is the P wave. Let me use a red pen there. This is the P wave. And another thing is, now it has pushed blood here. Now we are reading the electrical conduction. It has pushed blood here. So there is a time of flatness. And the time of flatness is where it is when this one is pushed, taking here, the electrode. This one is the battery taking the electricity to the atrioventricular. So the time that is taking to take to the atrioventricular is this flat line here. You see, we will read, I'm explaining this because very soon we are doing the main diagnosis of electrocardiogram. We will do it tomorrow only. So after it has taken time to push the electricity to the atrioventricular, we call it the Q wave. And where does the Q wave come from? Remember, we have a person that we have given the electrodes on the chest. So the electrocardiogram is monitoring the electricity here, how it is going. Stan's Kitchen, welcome to the platform. Greeting from your end to yours, doctor. Well, Stan's Kitchen, we love you. Thank you so much. Give me a like and share. Share this if you have Queen Glad to see you in the house. Queen Glad to see you in the house. So if you are here, please, and you have not liked, and you are, please like. So when it has given some time and it is in the Q wave, what happens? We get another impression. Now, these are contracting. You see, the electricity has come here. Now it has gone to the blood of his. When it is going to this bundle of his, there is a type of depolarization down here. Not actually depolarization, repolarization here before it gets here. So we get a dip. And then the muscles of the heart contract. When they contract, we call it depolarization. So it pushes blood. That is where we get the R wave. The R wave. The R wave. You see where the R wave is? The R. The muscles are contracting, and this electrode of ours are reading, the ones that we have placed on chest are reading electricity. So when it is contracting, the positive ions like sodium are inside the cell. They are giving positive reading to the electrode, and it is a positive setting. So it is pushing. So when it is pushing and it is positive, that is, I'm a bit busy, but I'm watching this video. This is a very timely lecture for me. God bless you. Thanks a lot. Thanks a lot, Stan's Kitchen. Thanks a lot, Stan's Kitchen. So when it is pushing, that is where your electrocardiogram reads what? We say the R wave. And you see the ventricles are big. The ventricles are big. So it takes long to push blood away from the ventricles. So it is a long ride. Ooh. And then it takes time to repolarize. It takes time to repolarize. So it goes down. Get it? After depolarization is repolarization. Repolarization is when now the sodium channels, the positive ions are away. Inside the cells of the muscles, we have negative ions. So we say it is repolarizing. It is repolarizing. Polarization is waiting to be polarized. So when it is repolarizing, they relax, they come, and then that is when the blood from comes in the left ventricle. The blood comes because it is repolarizing. The ions, the negative ions inside are coming back, and now the positive charge is going away. So it is losing the contraction power and it is relaxing. But when the positive ions goes inside the cell, it gets the electricity. It contracts like, because now this one travels like electricity. It beats. So it pushes. You get it? When it pushes, what happens? It gets a minute and then it repolarizes. So it relaxes blood to come in. That is the R wave. After the R wave, we have PQRS. PQR, you remember, where is that? There is something that we learned like last time. Let me see it down. That one is a little bit shoddy. I'll do another better one next time. Yeah? So it gives an S wave for repolarization, ready to polarize again. But you know, when the heart itself is repolarizing, there is a period down where the heart rests. It is called the diastole. The heart rests, and then after it rests, it's ready to give. So there is a place where the heart has another slow depolarization, and that one is called the T wave. It is called the T wave. So every person who is here, this one is called an electrocardiogram, and tomorrow we are going to learn about how you go to a doctor, and then those electrocardiograms are you are told go and do an ECG. You do an ECG, and then you see lines that are like this. We will learn, even if you are not a doctor, it's good to get what happens when you have high blood volume. Boss one, we did a video on high blood volume, and I will repeat after I explain this. There is a video, a very long video that we did on high blood volume, but I'll repeat for your sake. I will repeat. After ventricles contract, they need recovery electricity. So when they contract, they need some electricity to contract. So that is what we call the T wave, the T wave. You get it? So we will learn about electrocardiogram. So our patient is in the hospital, we have auscultated, we have done all those, and now he's in the echo. The echo, what we are saying, the echo with those electric functions and so, it means we want to check. Is there, now look at me precisely and good and well. Look at this heart. If the electricity is coming from the sinoatrial node to the atrioventricular node, and this one is dying somewhere here, it will not be passed to this side, so there will be no electricity. It's either it will be flat or it will have a very funny wave. You get it? If the heart is beating in a weird way, tachycardia, I mean the beat is so fast and beating so high, it means it will have funny waves. It will not have the PQRST complex as you see. It will have a funny wave. So we are learning and talking about this PQRST. Tomorrow is the day that we will learn and know how do these people know that this person has tachycardia on a P wave, on electrocardiogram. Tune with me tomorrow so that you can know. So there is a electrocardiogram. Let's deal with it tomorrow. Let me see. Is there anyone in the group that has ever been done electrocardiogram? If you are here and you have ever been done electrocardiogram, if you are okay by telling us I have ever, please let me see you. There is something I want to ask you. Please volunteer if you have been ever done an electrocardiogram, and if you are open to tell the people the experience, please volunteer so that I want to ask you a good question, of course, because Dr. Benjamin is a person who asked good questions and who asked questions precisely for helping. Now, we can do a chest X-ray. What can a chest X-ray show us? I've really talked about the electrocardiogram. A chest X-ray can show us the heart size or if there is heart congestion. And in a chest X-ray, if a person have, wait a minute, I never done anything like this dog. Really, it means God loves you so much and you are strong and you are healthy. So continue saying, God, you are gracious. God, you are grateful. I want to be rejoicing in your name every day. I want to say that, God, you are everything. Really. Hey, if you have never done them, may you be blessed and may you grow like healthy like that. Now, opacities. When air, a minute. Trying to check on something. Yes, I have never been hospitalized. Thank you so much, Rick. It means you are healthy and you are doing strong. So when you do an X-ray and you see a black part, you know that is air. You know that is air. If you look at your X-ray like this and then you see a black part, know that is air. So any person who is coming in, please, you are dealing with how to diagnose a person with heart condition. Please like the flow and come to the chat. If you have a question, you can ask any medical question and we may help you. We always have, I already have one person who has a question. And then we have fluid and tissues, white. So if you check on the place on an X-ray in the middle of your chest, you will always see a white patch. Why? Because that is heart, and the heart harbors blood. That is why in a chest X-ray, between the cavities here, between the chest cavity, you will see a white patch, because white means fluid and blood is fluid. You get it? So if you're coming in now, please make it be like. Yes, chest X-ray is important because it can show us lungs that are congested. Because if you see that in a chest X-ray, we are seeing white areas. The lungs should have air, which is black. But now in the chest X-ray, we are seeing white areas. Yeah? Imagine, we know your lungs are having fluids that are being retained inside. Or we see in your heart there is black areas where there is not supposed to be. We know that your heart has a problem and it is having air. And you know air in the heart is a death sentence. I don't like mentioning that. Big up Doc Benjamin and the amazing people in the house. Gabriel Mao, wow. Nice to see you again. Nice to see you here. Please welcome. We thank you so much. Our community is still here. And please, as we continue, don't stop to share the links of YouTubers that are here. Please share them. Please continue sharing. Don't give up. All the moderators, please continue sharing and sharing and sharing. Please continue sharing. So that is how the chest X-ray is seen. And then we can do some blood works. We take your blood, we go and check for some things in the heart, in the lab. How do we do this? You saw emboli and clots can make your heart to have a problem. So we go and check cardiac biomarkers like troponin. Troponin, when you have cardiac malfunction, one part of your heart is dying, there is something called troponin that we check. It is so high. Lipid profile risky for coronary artery disease. Lipid profile means you check for the cholesterols. You check for the cholesterols. So if one of the cholesterol, especially low density lipoprotein and triglycerides, high density lipoprotein is a good cholesterol that helps to clear the bad cholesterol in your. So even if it is high, there is a minimum place it should be, and there is an exaggerated place it should be. We check on it again. Blood sugar for diabetics. You saw most of diabetics are prone to infections. If you are a diabetic, you are prone to infections because your blood infections because your blood is having high sugar levels and you are prone to infections. So we can do ASOT for rheumatism, rheumatic heart diseases, antistreptomycin or tartare for problems like what? Rheumatic heart disease. We check in the blood. And then we do a full hemogram, full blood count to check if your leukocytes are how, your lymphocyte percentages, how are they? You remember our talk on how the white blood cells are produced, the culprit, the B lymphocyte, and the T lymphocytes, how they eat bad things, the macrophages. You remember? We do them to look at the full hemogram, to look at those places. We can look at your hemoglobin levels at the full hemogram. We check if you have low blood levels or high blood levels, because even now I have a question from Boss One asking me, if you have high blood levels, what is the problem? Those are the things we check. Advanced examinations like echo can be done. Ultrasound of the heart to check. You know, ultrasound shows it is a system whereby you take the knob, you place it in the body, and through the waves of sound, you can take pictures of what is inside. So there is one that we do for the heart that is called echocardiogram. Echocardiogram detects valvular disease, heart function, and congenital defects like tetralogy of Fallot. We talked about tetralogy of Fallot yesterday. What is tetralogy of Fallot? It has 4 conditions in one heart. You remember a hole in the septum extended this it extended right uh, pericardium, it is bigger, and then we have coarctation of the outer. The outer becomes small. You get it? Those ones. We dealt with them and we said right ventricular hypertrophy, pulmonary stenosis. You get it? Pulmonary ventricular defect, pulmonary stenosis, right ventricular hypertrophy, and then we say a hole in the septum. There are four things that you should check on tetralogy of Fallot. So for tetralogy of Fallot, you can do an echo and see them. When you're doing the ultrasound, you are seeing a hole here, you are seeing a big heart, you are seeing pulmonary artery stenosis, and you are seeing ventricular septal defect. Eh? You see, it is called the blue syndrome. It is called the blue syndrome. So those are the things we can do: cardiac catheterization and angiography. Cardiac catheterization and angiography is to check on the blocked veins and arteries. We check what is there inside. And then there is definitive management. Sometimes you can do a CT scan and MRI, a detailed one, to show how the muscles are. If there is a place that has been dead in the muscles, check the valves, check the pulmonary artery, check the outer, check the right atrium, left atrium, everywhere, the vena cava, and even the coronary vessels that come and supply this heart with blood. So you can check even risk factors assessment: hypertension, diabetes, smoking, sedentary lifestyle. All of that we can assess when we are doing these tests. Anyone with a question, now it is the time that you should be asking Dr. Ben a question. Thank you, Gabriel Mau, for sharing your email there. Thank you so much for sharing your email. Now it is a good time that we can ask questions, because Dr. Ben loves to talk a lot. Dr. Ben loves to sing a lot, and now it's time for my people to ask Dr. Ben, and let's interact. I will start with the first question that I've been asked. Hey, we are going up to 1 hour. The first question that I've 2 hours. The first: high blood volume and high hemoglobin. Now, this was a question that is asked by Boss One. Boss One, we have two things. We have high blood volume and we have high HB in your body. I knew maybe you may be confused. So I'll give you both so that you can know the real thing. Does colonist seen any of these symptoms you speak about? Colonist. These are things, Ridley, these are things I see every day. These are things we see in the hospital every day. Every day, we usually see these things in the hospital. So, by meaning the colonists, what does the colonist mean? I would like to be enlightened. Now, high blood levels, if you have high blood or colonoscopy, no. The colonoscopy is dealing with your colon. Let me show you. Really, that one I'll answer faster. The colonoscopy is dealing with your colon. This way, the colonoscopy is dealing with your colon. Where is my blue? Yes, this one. Colonoscopy. I'm doing things hurriedly. Sometimes I'm confusing everything. I'm confusing everything. Colonoscopy. Let me draw this like this. Ridley, look at this. This is your colon. So colonoscopy, they put a camera. They put a camera here, and then it enters here. It checks the walls. It checks the walls of your colon until here. When they have taken pictures and they have taken pictures and they have checked the walls of your colon, it is removed with the video and the picture. That is what we call colonoscopy. I want to give you something, to show you something here. I want to show you something here. Not know if they have taken it. You know, sometimes my office you come and then you get some things are not there. They have gone to use them. Where is that? Where is that? I want to show you something here, very important. I want to show you something very important. Yes, this one. It looks like this, Richie. This one. Now, this one is the part that goes inside. This one. This one is a camera. This is a camera. So when you have this, let me show you. When you have this, like this one, I can use it using my phone. Let me show you how I can use this. This is my phone. This is my phone. And I take an adapter like this. This is an adapter. So this adapter, what I do with my phone, I'll put the adapter here. You see, I've put my adapter, and then I put down the camera here. You see, now this is the camera. Now this is the camera. How USB. And then when this camera is lit up and I'm pushing it into the colon inside you. You see what is happening to my phone? You see? Let me put it somewhere in my mouth. You see, you may look at my dental now that happens to the colon down there, deadly. So you cannot visualize the colon with the heart. The heart is called angiography. The heart is called angiography, and the colon is called colonoscopy. So you cannot visualize. Susan Mwendwa, official, Susie, Susie. There are some songs that fathers used to listen. They are called Zilizopendo. The name Susie reminds me a song that my dad used to love so much from West Africa. It was sung like, Rosie, Rosie, mama, Omwana wa mama. Yeah? People from West Africa really know how to sing. They started singing so early. Now I was answering our friend, our procurement officer, our partner here, our friend, Boss One. Increased blood volume can make you have hypertension. It strains the heart. You can get a heart failure and may progress to congestive heart failure. Pulmonary edema. You see, as the blood is so much in your body, it may force some fluids in your lungs and you may lose some breath. And that's why it's not good to give a person a lot of fluids when this person is on shock, because it can make that person to die. It can make that person to die. And then peripheral edema, because you have so much fluid. Some of them is coming from your arteries and veins and the lymphatic circulation. It is coming to the muscles. You get a swelling of the legs, ankles, and feet due to fluid leakages. Dilution of blood components. You get your blood components are diluted. You get it? And then here, the vein that takes blood back from there, you get it is distended. You check it out. If it is distended, You have something called neck visible veins, indicates increase in venous pressure. Yes? And in the kidney, what can happen? Kidney try to remove excess fluid, so it becomes overwhelmed and worsens fluid retention. That is when you have volume that is high. But there is something that people confuse it. What of high hemoglobin levels, the red blood cells, because people confuse volume with hemoglobin levels. Let's continue to like, we are getting up to 30. Let's get 30 more. Let's get 3. Who has not liked? If you have not liked, like, please, we get to 30 as we are continuing to finish. As we are continuing to finish. High blood hemoglobin levels. High blood hemoglobin levels means this: increased blood viscosity. The blood becomes thick and it flows very slowly. And when your blood flows very slowly in your body, what will happen? What will happen is you can get a clot. Blood should pump at the same rate as it is needed. The heart beats 60 to 100 normally. So 60 to 100 beats means your blood should go normal without rushing at a good pace. You don't want people to get blood clots. Risk of thrombosis can lead to stroke, deep vein thrombosis. Deep vein thrombosis. I've talked about it so much and I'll explain it again after when we are doing treatment. Seen in conditions like polycythemia, DVT. Now I'm explaining about high HB, which people confuse high HB with high blood volume. Increased blood pressure, hypertension. Sickness increases high blood pressure because the heart pumps with more power so that it can move the blood. Reduced tissue perfusion. Despite high HB, oxygen delivery is poor due to slow movement. So it doesn't mean that if you have more red blood cells, you have good perfusion of oxygen. Your blood is moving so slow and you are having slow perfusion. You get it? You are having slow perfusion. So we have the heart itself. The heart itself will strain, and then you start having headache, dizziness, blood vision, red face, fatigue. And the causes may be dehydration, chronic hypoxia, lung disease, high altitude, bone marrow disorder, and polycythemia. Those may be the problems. But we have something else like high white blood cells. High white blood cells are seen in infections, and that one we will deal with it when time comes. Hope I have answered our friend so nice as it is needed to be answered. So anyone with any question, we are beyond 2 hours now with 4 minutes. Anyone with any questions before I log out? Because tomorrow I'm helping people to know what this is. Tomorrow I'll be helping people to know what this is, because this one is the key diagnostic tool when it comes to heart conditions. That one is the key diagnostic tool when it comes to heart conditions. So tomorrow we have a session. Sorry to be interrupted, Benjamin, but I have said, being the first day here, I'm enjoying the live as I'm gaining some information that may help in real life. Akanesha, thank you so much. That is what we really want. As you are enjoying the fun, as you are enjoying Benjamin singing, interacting with people here, as you are interacting with each other, We want to gain something that can help someone someday or save a life. Yes. Thank you so much, Akanesha, for that. Thank you. Anyone with any question before I log out? Anyone with any question? Benjamin, the wise guy, is here asking if anyone is having any question or anything random or any insight. You know, even an insight is a good thing. You can text any insight, like Gabriel Mwau giving, telling Susan Mwendwa that you are doing a good job. As we listen to Benjamin, the wise guy, I would like you to visit here. Miss Marie, you are doing a good job. As you continue to do this, you get it. Let's get those insights. Let's get those insights, my friend. Let's get those insights. Let's get those insights. Let's just not go without. If you want me to improve, if you want me to improve on something, please tell me. If you want me to improve on an area, please tell me. I want you to improve on this. If there is a topic that you really want us to discuss, let me have you here. Let me discuss the topic. You get it? Eh? My friends, and I am so passionate about helping people's health. Yes, I'm so passionate. So why are we silent? Please give an applaud to Benjamin the Wise Guy plus the group that is supporting Benjamin the Wise Guy. Give an applaud, my people. Give an applaud. Cute Jessie. Hey. Cute Jessie. Hi, hi, mom. Hi, baby. Cute Jessie, how are you doing? It's better late than never. Me, I have a question on a serious health issue. Yes, bring it, bring it. What is your question, Susan? Susan, Cute Jessie, please like. Please don't go without liking. What is your question, Jessie? I'm waiting for it. It is a serious health issue. Me, I have a question on a serious health issue. Give me that question we see. Please give us that question. I'm waiting for you to type it. I'm waiting for you to type it. I'm waiting for you to type it. Give us that question. Give us that question, please. I'm waiting for you. I wonder if you could cover a topic on social anxiety disorder. I have that. Guys, Akanesha is new here and I like number 28, like now 28, brother. My sister has been looking for a child and she don't get. Oh, Susan Mwenda. Yesterday we talked, check the stream of yesterday. It has become a very, it has become a talk. I am Naliaho. Naliaho is here. Even if you have come when it is going late, please like Naliaho, like the topic. Please like the topic and we can give me the like, but we are so honored to have you here. It is time for questions. It's time for questions. I was answering our friend who is, I was answering our friend who is Susan Mwenda. Susan Mwenda, how old is your sister? Does she have a child? And how old is that child? Please answer me those questions. Please answer me those questions, please. How old is your sister? She has been using the 3 months family planning. Okay, that means that does your sister have a child? Does your sister have a child? Does your sister have a child? Please answer me that question. And likes, man, if you have not likes, let's get to 30 today before we log off. Now, my sister has looking for a child, but she doesn't get. That one I've answered. I wonder if you could cover a topic on social anxiety disorder. I have that. Akanesha, we started by discussing matters concerning mental health. Check my profile. There is anxiety disorders on mental health playlist. Check on mental, but we will do it, we will repeat because it comes on a topic of other topics that are covered. But for now, because we are dealing with cardiovascular this month, check on the playlist of my playlist. There is mental health playlist. You will see those topics there, including anxiety disorders. There is a topic of anxiety disorders there. Please go and check on it. Now, she is 25. She is 25. Okay, that one gives me a talk on Susan Mwendwa. When you have used 700, when you have used family planning, progesterone, all it is called, I think it is Depo that you are talking about. There are some things. There are some things you should know about this family planning. Once you have injected yourself with them, okay, I'm just looking outside to see someone is knocking. Okay, everything is okay right now. Everything is okay. Okay. Okay, I'm just looking at something and everything is okay. Everything is okay. Now, when you have used family planning for some time, when you are using, sorry, when you are using family planning, there is no way you can revert the effect of that family planning, especially hormonal family planning methods, especially hormonal family planning methods. So it inhibits ovulation, thickens the mucus, thickens the uterine lining, and the 3 months is a long time, effective and very high. So it gives you secondary infertility. Like we have 20 minutes to 7 to just go through this so faster. Inability to conceive previous having a child causes can be male or female. We talked about it yesterday. Tubal blockage, ovulation problems, and hormonal disorder. So DEPO and fertility, we call it DEPO here in Kenya, is suppressed only while using DEPO. You get it? But DEPO is not cause of permanent fertility itself. It is not permanent. True secondary fertility uses arises from tubal damage. So my friend who is Susan Mwendwa, she may take some time, but often, obviously, after some time, she'll get a child. We talked about fertility yesterday, but I see time is going out, and I would really like to answer you well. So tomorrow I'll start by your question. It's a big question. At Jamaican Uncle, you give me an extra connection too. How are you? Uncle, say nice. I'm Naliaho. So let me not get it's 30 now, the likes. Oh, thank you. And she has girl 5 years old. So let's see. My sister is calling. Yes. Okay, sawa. Tuongea mwenye session. Okay. Now we continue checking up on each other. You know, we have really discussed matters and it is 2 hours now. Thank you for that spirit, guys. Thank you for that. Let me not take more questions. I have 2 questions to cover. I have JC's question and I have this is boss one. I covered your question so well. And we have Susan Mwenda about the family planning and not getting a child. Although we talked yesterday about that, we talked yesterday about issues of child and bearing and some issues about that. And social anxiety. Kanesha, please, before I talk about that tomorrow, hurriedly, Go to my playlist of mental health. You will find there those talks. There is a topic on anxiety disorders. It will help you big time. So, my sisters and brothers, as you share the channel, thank you so much for being here. Thank you so much for everyone who is supporting me and also supporting my friends who are in the channel. And I can see even Jamaican angle. Thanks to you, Benjamin. Really appreciate this. Good. Yes, Susie ran away from home. That's the song. I can say that. I can see some people are going live after this. Please go and support them, especially Jamaican Uncle as a premiere at 7. And please, we have talked a lot, and I thank you, all of you. If you have any question, any topic that you would like me to talk on, we talk at 10 a.m. when the normal procedures are not, like we are in a cardiology month. We talk about cardiology issues. The email address is there, and some people have got my number. Please text me. Yes, yes. Thanks. Yes, we'll definitely watch that after the live. Yes, you can even watch the whole of the mental health issues playlist. My playlist, especially Brother Benjamin. Hey, hope you guys are working in my playlist. Everyone works in your playlist. You know, I have Cute Jace. I have friends that when we say today we are going to visit Cute Jace, we visit there so well. So don't worry, Cute Jace. My gang is always on the look. Don't worry. So I was saying this. Uh, if you have a topic you'd like us to talk about, this is the normal hours from 4:30 to 5 Kenyan time. In the US, it is around. Thank you, Ben, for such information. It's you check what is in the US or where you are. If you have an emergency topic, we talk after 6, 7, 8, 9, 10. So I come live after 5 hours again and cover your topic that you've asked me to help in. So when I cover the topic that you've asked me to talk in tomorrow, we will not start with the question, but the question that has been asked about family planning, that one needs a major talk in. So I've held it pending, and I will say when we will talk, but we can do it at 10 today, after 5 hours, or tomorrow. So everyone who has been watching me, please watch other channels too. Subscribe to people that are here and that are supportive. These channels help us to grow. You've seen my story about Queen Bee when I was tired and everything was not going okay with one of my patients, and it ignited the spirit and everything became well next day. It's because Queen was directly talking from heavenly spirits, from God. Thank you so much, my friends. Thank you, everyone that has been listening. And I've not stopped anyone to drop a question. Please drop the question, even in the comments. Drop the question, drop the questions, and drop the questions. Let's interact. Thank you so much. Thank you, everyone. Can I say bye? Can I say bye? I know someone like you, Jesse, would like me to sing and feel nice, but time is up. Let's continue to talk tomorrow. My friends, see you tomorrow. See you tomorrow. Bye bye. Bye. Bye bye.